So parents are concerned about medications, antibiotics that are being given or for any treatment. So let me try and simplify it for you. When the child comes to us first, we do a detailed assessment, clinical, and we also do a detailed blood workup. We have to ensure the child's hemoglobin is good, the child is healthy, there is no infection, the liver is working fine, the kidney is working fine. Then we do a stimulation using granulocyte colony stimulating factor. This is known as filgrastim. It's a recombinant protein, and this stimulates the bone marrow to produce more cells. So again, it is safe. Only 2 doses are given. Following that, during the procedure, every child has to be sedated, and total intravenous anesthesia is given, sedation with a little top of general anesthesia through intravenous route or through intravenous access. The child receives antibiotic coverage of 2 days. So just 2 days of antibiotic, intravenous antibiotic, 1 dose on the day of the procedure. The next day, 2 doses of oral antibiotic, just 2 days. We give painkiller as a cover. Usually it's a Tylenol or a diclofenac. This is to help the child deal with any soreness or pain. And since we are giving antibiotic and painkiller, we do give pantoprazole, and along with that ondansetron. This is to prevent gastritis and vomiting. So this is the basic. Followed by that, after the procedure, if the child is unable to sleep, we may recommend melatonin. If the child is very hyperactive, we may give some medications to reduce the hyperactivity. Those who have a history of seizure or whose EEG is abnormal, either previous EEG or current EEG, we would recommend 6 months of anti-epileptic medication, because sometimes the cell therapy may stimulate seizures in such patients, in 6% of patients. So anti-epileptic cover in those who have a previous history of seizure. The later part is, of course, we are looking at the gut of the child through gut microbiome, any imbalance in the gut in terms of increased fungal overload, or if there is bacterial dysbiosis, or if there is worm infestation, or there is vitamin deficiency, we would supplement accordingly. We are also doing the micronutrient testing like folic acid and vitamin D and homocysteine levels, B12 levels. We're looking at MTHFR gene mutation to check whether the folic acid is being converted to an active form, that is L-methylfolate. And in case of any deficiency, then we are providing for compensating or giving supplementation based on these blood workup. So that's all. We do not give any long-term medications for suppression. No immunosuppression is required. That is the beauty of autologous bone marrow cells usage. So no long-term immunosuppression is required.